the serotonin hypothesis is exactly what justifies the use of antidepressant drugs, because of course these drugs purport to correct a chemical imbalance. SSRIs are selective serotonin reuptake inhibitors, essentially resulting in a net increase of serotonin circulation throughout the brain. And so again, this all rests on this theory that has at this point been undermined, debunked, no longer taken seriously by people who should be taken seriously. And so it just, that's a huge, like, that's a next level of cognitive dissonance. It's not just that your belief system is being shaken, it's that your entire treatment approach is now called into major question. So that's just fascinating. And I mean, not that surprising that people would be in denial. Again, we kind of know how people react to dissonance, and there's always a lot of denial, a lot of justification, which again makes me just feel all the more respect for people like you who are willing to just say that, be honest, you know? So let me ask you this. I understand that you had already changed the way you practice and think about various psychological conditions. But even so, what bearing did this have on your practice?
Yeah, that's a great question. I mean, honestly, what it kind of did was actually drove a whole bunch of people to my practice.
Mm,
Because essentially, I think, there were a lot of us that already kind of knew that this was a myth. There were clinicians and a lot of patients, I think, who had kind of figured this out on their own. But there were a lot of people who really didn't. And what I saw again was this, so many people just, general population of people seeing this, realizing, I mean, and I just have to say, like, I got so many comments, I received so many comments and emails, and just the stories that I've heard, like the heartbreaking stories, like, for example, like, I heard from somebody who was like in their 40s, they were told when they were 13 that they had a chemical imbalance, and they have been medicated for decades, and they have been taking these medications every day for decades because they believed that they had a chemical imbalance because someone told them that. So to be doing something like that for decades, and then all of a sudden it comes out that it was never the case, and actually even it was never even really a real theory at all,
mhm.
right? I mean, I can't even imagine like what that would feel like. Yeah, sorry, I got off topic there.
That's okay. That's
And I'm not sure if I answered your question, but yeah.
I mean, yeah. Did you, would you say, I mean, thank you for mentioning that. That's very relevant to kind of think about real people and the effects that a myth like that had on very real people. Because of course, with decades of being on a drug like this, there are almost always adverse effects, and they're often quite significant. And then attempting to withdraw from drugs like this, first of all, needs to be done under professional supervision. Like if you're listening to this and you're thinking about suddenly coming off your drugs, you shouldn't suddenly do that. Really, in the same way that no one should suddenly come off of any drug, legal or illegal, that they've been on for a long time. But so, yeah, thank you for bringing in that kind of real case. But yeah, so would you say that you had already departed from regularly prescribing psychotropic drugs
Oh,
before this
yes.
even came out?
Yes, 100%. So when I left, I guess it's been about 5 years ago since I left my job. I was running an emergency room in New York City. I left that job to basically found free range psychiatry. That was the last time, except for a couple little rare cases where, like, somebody in some acute psychosis and things like that, but
Mhm.
definitely no antidepressants. Have I prescribed in 5 years?
Wow.
And that's the other thing I wanted to just to finish off the thought about your question about how this affected, my practice and things like that. So that's what I do. My expertise is getting people safely off of psychotropic
Okay.
medication. That's what I do. And so, again, when this video came out and when all this hit the news, of course, now all of these people who suddenly realized they were kind of taking these drugs for maybe no reason were kind of coming to me and saying, okay, I would like to get off of these and
Yeah.
we need help. And I think that's a whole separate topic, but that's a big crisis that we have right now
Yes.
because there are millions of people, taking these psychotropic medications. And I do believe the world is starting to wake up. I am seeing that people are starting to question it, especially because of the study. But even before that, I think it was starting to happen.